Bismillah ar-Rahman ar-Rahim, my dear MRCS candidate. Here are some of my advice how to pass the MRCS Part B exam safely. One of the very difficult station is the phone station. Uh, a lot of candidates think that phone station is an easy, straightforward station. It's not. There's a preparation station before where you are supplied with patient information, history, examination, and investigation. And the investigation will include something like 20 investigations. Full blood count, USNEs, liver function test, clotting profile, and other investigation. And you are asked over 9 minutes to summarize what you have. So they will always provide you with paper and pen to summarize. Then the next station, you will have only phone, where when you lift the phone, you will speak to consultant on the other side. This station testing your skills, how you grab the situation, how you can summarize the information, how you can focus on what is important, what is not important. And these skills, you don't usually use it in your practice. So for example, suture skills, you use it every day. Incision and drainage, you use it every day. But summarize this patient file over 9 minutes, give me a summary. These skills, a lot of the candidates, when they come to the exam, they haven't done it before. So my advice is to train yourself, and that's why I have created a platform of virtual OSCE station, which hopefully will do it today with the phone station. You will be provided with patient information, 9 minutes, try to grasp, and here they put you a little bit of a stressful situation, like a patient with very low hemoglobin, which is you're not sure why he have low hemoglobin. Sometimes with white cell count, which is raised, and you're not sure why it is raised. Infection, where is that infection? And it also tests how you communicate with a consultant, how you introduce yourself, how you know whom you are speaking to, and that you will write all this documentation in the notes. And here also he will test you some of the communication skills. Do you think this patient need to be transferred? Yes or no? What preparation for transfer? What circumstances you need to adjust before the transfer? And some other question, and he will assess your response. So it's a vital skills. You will need it when you practice, and it's a skills where you need to train yourself multiple times. I create my OSCE station using artificial intelligence. So these are not the stations that are found in the Royal College or going to be there in the Royal College. But it doesn't matter as long as I train your skills. You can pass any phone station without a problem. Another thing which is important is the lab result is provided at it is written in United Kingdom healthcare. So some parameters are different. Sometimes you use micromole instead of what you use in your hospital. So if you can imagine, you are just coming out of a station, done not so good, and you think about it and you go to a room, 9 minutes, you have 25 or 30 lab result with some patient information, with things are not straightforward. Patient feeling ill, have nausea and vomiting, want to be transferred, and after 9 minutes, bang, you have a phone call to speak to a consultant. It's not easy, and it needs to be trained. And this is my advice. You must do 20 to 30 phone call station, get a certain file, and I obviously put my platforms that you can use, and you can enroll your name into the candidates which we are going to test. You are very welcome to join us today as well, and I will upload the video of that training to this platform. I wish you all the best. I'm sure you will pass the next MRCS exam straightforward with very high mark. I wish you all the best. My name is Dr. Muhammad Omar Farouk, consultant vascular surgeon.